Triangle of Koch. Boundaries of Koch triangle. Opening of coronary sinus on posterior wall of right atrium. Septum cusp of tricuspid valve. Right atrioventricular valve. Tendon of Todaro. Subendocardial collection of collagen fibers. Opening of coronary sinus on posterior wall of right atrium. Septum cusp of tricuspid valve. Right atrioventricular valve. Tendon of Todaro. Subendocardial collection of collagen fibers. AV node lies at apex of Koch triangle. The AV nodal reentrant tachycardia radiofrequency ablation of AV node is done at triangle of Koch. Boundaries of Koch triangle. Opening of coronary sinus on posterior wall of right atrium. Septum cusp of tricuspid valve. Tendon of Todaro. Tendon of Todaro. AV node lies at apex of Koch triangle. AV nodal reentrant tachycardia radiofrequency ablation of AV node is done at triangle of Koch. Formation of aortopulmonary septum. Aortopulmonary septum is derived from neural crest cells. Neural crest cells migrates towards the truncus arteriosus and form truncal and bulbar ridges. These ridges form a spiral septum called aortopulmonary septum. This AP septum divides the truncus arteriosus into two vessels, anteriorly pulmonary trunk, posteriorly ascending aorta. AP septum divides the truncus arteriosus into two vessels, anteriorly pulmonary trunk, posteriorly ascending aorta. Right atrium deoxygenated blood, right ventricle deoxygenated blood, then it goes into pulmonary trunk, then to lungs, then oxygenated blood comes back to left atrium, it goes to left ventricle, it goes to ascending aorta. This is systemic circulation. Persisting truncus arteriosus. Absence of migration of neural crest cells to the region of truncus arteriosus or absence of neural crest cells. No AP septum formation. Truncus arteriosus persists. No ascending aorta and no pulmonary trunk. Mixing of oxygenated and deoxygenated blood occurs. Cyanosis occurs in baby. Transposition of great vessels. This AP septum is not spiral, hence the vessels are straight and open into opposite chambers. Right ventricle opens into ascending aorta, left ventricle opens into pulmonary trunk. This leads to cyanosis in these babies. Therefore, for these babies to survive, patent ductus arteriosus is essential so that some deoxygenated blood from aorta can be sent into lungs for oxygenation. ASD and VSD also develop as compensatory mechanisms. Tetralogy of Fallot. Anterior migration of AP septum. Pulmonary trunk becomes narrow. Aorta becomes large and overrides the interventricular septum. Pulmonary stenosis. This causes increased pressure on right ventricle. This leads to right ventricular hypertrophy. Right ventricle also starts to push the blood into aorta. Mixing of oxygenated and deoxygenated blood is also seen. Main components of tetralogy of Fallot. Pulmonary stenosis, overriding of aorta, ventricular septal defect, hypertrophy of right ventricle. Main components of tetralogy of Fallot. Pulmonary stenosis, overriding of aorta, ventricular septal defect, hypertrophy of right ventricle. Pulmonary stenosis, overriding of aorta, ventricular septal defect, hypertrophy of right ventricle. Main presentation is cyanosis of the baby. Pentology of Fallot. Tetralogy of Fallot plus atrial septal defects. What is tetralogy of Fallot? Anterior migration of AP septum. Pulmonary trunk becomes narrow. Aorta becomes large and overrides interventricular septum. That leads to pulmonic stenosis. This causes increased pressure on right ventricle. This leads to right ventricular hypertrophy. Right ventricle also starts to push blood into aorta. Mixing of oxygenated and deoxygenated blood is seen. Pulmonary stenosis, overriding of aorta, ventricular septal defect, hypertrophy of right ventricle. Main presentation is cyanosis in baby.